folks. I'm Dr. Amy Pearlman. I'm a board-certified urologist with expertise in sexual health, hormonal health, and genitourinary health. And I have Richard Connell here with us today. Richard, say hello to the crew.
Hello, everyone. Hello, Dr. Amy.
So if you wouldn't mind giving our viewers a brief introduction, Richard.
Yes, nearly 3 years ago now, when I was diagnosed with Peyronie's disease, and I was recommended a RestoreX device to use traction, and I just found it very difficult to use and quite painful. So I decided to set about making a alternative way of clamping the end of your penis so that it would be a lot more comfortable and easy to use and less tape and a lot less time messing about and that kind of thing. So I came up with the comfort grip, and it clips straight into the RestoreX. You just remove the existing clamp, clip the comfort grip in, and using the rotating bezel, the fingers just close and it grips nicely around the end of your penis, and it's very quick and easy and comfortable to use.
Awesome. And I'll include the link to a prior video that you and I recorded going into the details of the comfort grip. You know, in my practice in Miami, Florida, I do recommend the RestoreX to a lot of my patients. This is the clamp here that comes with the existing RestoreX, and some of my patients get concerned about having to use this clamp here to essentially, push down or clamp the tip of the penis here, right? So the kit now comes with a makeup pad, which has been really game changing in terms of optimizing the comfort of the existing RestoreX. But as a urologist and an innovator, I'm an early innovator and adopter of new technology. And I love when people reach out to me and they say, hey, Amy, I want to talk to you about something I'm working on, because we can always improve the patient experience. So I now, whenever I, discuss the RestoreX with patients, I'm also discussing the comfort grip. And as Richard mentioned, like, this has also been a game changer for a lot of my patients, that now they're able to more easily use the RestoreX device. But you're not done there, right? You're constantly innovating your product. So you've come up with two things that have been more innovative with your existing comfort grip and can be used with the existing RestoreX device. Why don't you start with this attachment here? Because this says on the top here +3, so it has an additional 3 millimeters to it. Why don't you tell us what that additional 3 millimeters does? Because where we're talking about here is additional 3 millimeters right here. So tell us how this connects to the comfort grip and who it can help.
Okay, so I receive a lot of emails from customers and people with Peyronie's disease, and many of them have said that due to a number of treatments, maybe an operation, they've lost girth on their penis. And when they've used even the comfort grip, they've found that it doesn't close down enough to properly grip them. So it made me think, well, what can I do to help these people? So I came up with a new silicone band, which it replaces the original silicone band. All you do is carefully slide it off and just slide the new one straight back on. And as you say, it's 3 millimeters thicker on each of the pads, or an eighth of an inch when you're your side of the water. And it's more silicone, so it's softer and it closes down that bit further. And so far, I've sold a lot of these, and all of the people that have tried them have said it's really helped and made a difference for them. So that's been really quite exciting that we've achieved what we set out to do. I tried a number of different thicknesses. We tried 2 millimeters and 5 millimeters, and we ended up with a compromise somewhere in the middle that kind of worked best all round. So that's how we ended up with a 3 millimeter thicker silicone band.
Gotcha. So follow-up question here. So if someone orders the comfort grip, is it going to come with the standard silicone attachment?
That's right. Yes,
Okay.
it comes with the standard silicone attachment, and then if they feel that they're of a lesser girth or they've lost girth, and they might need it kind of about of 1 inch. So if you've got a 1 inch diameter penis when it's flaccid, you're kind of on the border. So you might prefer the +3 silicone band, you might not. There's no way of telling. You just have to try it. Um, that is the only way. So Obviously, if you know that you've got a less than an inch girth, then it'll definitely be more comfortable and will fit. But there is people who are on the cusp that aren't sure either way, and like I say, all you can do is try it. And I think the male penis is just so different in everyone that there's no definite yes it'll fit or no it won't fit, because everyone is so different. The way your penis compresses and squashes down when you're gripping it is different in everyone. So I can't definitely say it will work for you, but you know it's something to try.
Okay, so I'm just going to demonstrate how to take this off. So I'm just sliding this off here. So very simple. Let's see if I can get this other one on here. Very easy. All right. Am I doing that right? Looks right.
Yeah, great job.
Perfect. So as you can see here with the additional like 3 millimeters, it's going to allow for more of a tight fit around the penis. And then I just want to demonstrate like where this would fit around the penis here. Actually, do you want to demonstrate on your side? I know you have a penis handy.
Yeah, sure. So with the silicone band in place, you just put the end of the penis in as you normally would. With the back of your glands kind of needs to be in line with where my finger is there with the back of the comfort grip, and then you just turn the bezel until it gets a good grip, and that's it. All you need to do. You're ready to go.
And Richard, how does someone know when it's tight enough?
Um, Something that's worth trying is before you even connect it into the RestoreX
And just
device.
for context here, so this is the RestoreX device, and this would just connect
Yep.
like that. So he was showing it without it being connected, but that's how it would look.
Yeah. So I get asked this question a lot from people that have purchased the comfort grip, and I generally say to them, fit it to your penis and turn the bezel until it starts to feel like it's getting a good hold, and start to manually stretch. Don't even clip it into the RestoreX device at this stage. Just have a good feel. And if you do need to make it a little bit tight, you can just turn the bezel just a small amount, and you can feel how it's compressing and gripping. And as you start to manually stretch, you'll know if there's any slippage at all. So you just go a little bit tighter, until you're not getting any slippage at all. And then once you start getting a bit of manual traction, you can then clip it into the RestoreX device and start again. And it's a good way of like getting a feel of how to do it, because once you've clipped it in the RestoreX device, the whole thing would start to become quite cumbersome and difficult to maneuver if you're not used to it.
Mm-hmm. So you're saying to do exactly what you were showing, which is try this out without it being attached first. So I guess
Yeah,
the moral of the story there is keep making it tighter until you're preventing slippage, but not too tight that it's painful, right? This should not cause pain. Is that correct?
it should not cause pain at
Okay.
all.
All right, awesome.
Yeah.
All right, so you came up with that innovative add-on. Now I want you to talk about the comfort bend and why this was necessary to design.
Okay. Yeah. I'm pretty excited about the comfort bend because even though it looks like a fairly simple, not a lot to it, it just looks like a simple plastic part. There was probably more design time and thought went into this than the actual comfort grip, and that took long enough. And so going back to the beginning, I was struggling with counterbending, and I was receiving emails from so many men that had either bought the comfort grip or they still use the clamp, or some men even still use both. And they were saying that when I bend, I slip out too easy. If I try and bend too much, I find it really difficult. And I was having the same problem. It's this there was something fundamentally not right, and I couldn't put my finger on it. So I
Mhm.
decided to go back to basics, dive into it in a problem solving kind of way, and see if I could work out exactly what was going wrong. And what I found was when you clamp a penis into the RestoreX, like so, with the clamp, and you activate the bend. So if I bend that round there now, you're putting a huge amount of pressure just on this outside here, where it's trying to pull everything down. And this is why people are finding it painful and slipping out. And it's the same when you use the comfort grip. And I'll clip the comfort grip inside my RestoreX.
And really quick, because on the penile model that you have, it looks like he's uncircumcised. So the foreskin is over the glands. And so I just
That's
want to
correct.
clarify, when people are using the comfort grip, are they retracting their foreskin behind their glands, or are they keeping their foreskin over their glands?
Um, I've had so many emails about that very question. What should I do? And I basically say the same thing to everyone. Do whatever's most comfortable for you, because some people prefer to leave it forward, some people prefer to pull it back, some people, just like I do, just let it do what it wants to do, and it'll sort itself out. It's if you have still got your foreskin, it becomes a very sensitive area and quite um, delicate, if you like, to the touch. So I think if you pull it back and you're exposing that skin underneath that's already very sensitive, and then you're putting a clamp or a grip or something on that as well, it can start to become even more painful, and it doesn't need to be. So I think that the foreskin is um, a hot topic, and I think it really is just try what suits you best, and then that's right for you. And it is, again, everyone's different. Everyone has to try what's going to work.
Mhm.
But so we put our penis inside the comfort grip, so we've got a good grip. And because with the comfort grip, the penis is held on a center line. If you can imagine that there was a piece of wire running up the penis all the way into our body, it's the whole thing is held around a center point. Whereas when you use the original clamp, it clamps it down to this baseline here and then bends it around this curve. With the comfort grip, it's holding it all about a center point, because the
And if you could
fingers.
hold that up a little bit more for us. Yeah. Okay, great.
Sorry, yeah.
Mhm.
So that you end up with a gap underneath your penis here, and then when you start to counterbend, you can see that I'm actually putting a huge amount of stress just here, and I'm not actually getting that much of a bend. I'm putting more of a kink on the end bit here, and I'm not really bending much around the RestoreX bend at all. So I started looking at this as a problem, and how can I solve it? And when you look at tube bending, because the penis really is, or the way I look at it, and you'll probably laugh at me for this being a urologist, but the penis really is three tubes within another tube with a load of sort of squishy bits all in and around it
That's
to hold it.
exactly how I explain it to patients. Richard, you're on point.
So the principles of tube bending is whatever diameter you are bending your tube, then you need to bend it around something that's double the radius. So if our average penis is around about an inch, especially if it's being stretched, then we need to bend it around something that's around 2-inch radius or 4-inch diameter. So I printed these 3D printed rollers. So this is 23 millimeters, or just under an inch. So this is what the exact curve of the RestoreX curve that you're bending around. And you can see if I take my flexible penis and I bend it around that, you can see that that is creating a very, very tight curve, and it puts the underside of your penis into compression, and the outside goes into quite a mad stretch, and you're putting a huge amount of pressure on your gland at the end, trying to hold on to that going around that bend. So in the ideal world, it would have needed a 2-inch roller to make it kind of more accurate. but due to the design constraints of the RestoreX and the space I had to play with, I couldn't go quite that big. So I just went as big as I could, which ended up being about 40 millimeters. And so you can see that's the kind of bend that we need to really be bending around to not create as much pressure at the end. And but the whole penis is in stretch rather than the outside in stretch and the inside being compressed. So once I'd worked all that out, it was then a case of coming up with something like this that could work with what we have. So if I clip the penis back into the comfort grip, like so, and we've got this gap underneath, I can very easily actually slide my comfort bend into that gap, like so. And we now have taken up the gap that was underneath the penis. But we can see that just here, you now have our roller sized diameter that we're going to bend around. And when I start bending around that, you can now see that the curve is much more gentle. We're still getting the same kind of stretch that we need on the outside to stretch the Peyronie's plaque, but we're not causing any other problems. Now, what actually made this quite difficult to design was the fact that when you are bending a tube around a fixed point, you end up with a different load this side compared to this side, because you're pulling down from one end, or on the RestoreX, you're pulling from this end where the springs are. So I ended up coming up with a load of fine ribs that move and flex. So as you start to bend, the more you bend, the more the whole thing can move around with it. So you're not putting mismatch of pressure either side of your penis. So you're getting a whole stretch right the way around the whole curve. And it makes it so much more comfortable. I've actually found it really quite easy to use and really comfortable.
Wow, that's fascinating. And yes, it looks very simple, but there's a lot of thought behind this simple, innovative therapy here. So I want you to show, because there is a correct way to place this on the RestoreX. So which way do you place it? Which way would go
Yes,
towards the tip of the penis?
you put it so you can read the word comfort bend when you look down. So and it's got a slightly longer edge this side, and that slots into the gap in the RestoreX where the sort of comfort grip or the clamp clips in. It slots into that little slot there, which
So like you're talking about like right there.
that's right.
Yeah. Okay.
That's it. Perfect.
So with this would be something that someone would purchase as a separate like attachment, correct?
That's right. Yes.
Uh-huh. So do you
Yeah.
recommend everyone who has a comfort grip also get the comfort bend, or would anyone benefit from using the comfort grip without the comfort bend?
Again, I receive a lot of emails from men asking me this question: do I need a comfort bend? And I'm actually quite surprised at how many people, how many men have bought a RestoreX for whatever reason, but they actually just use it for straight traction and don't use counter bending at all. And as I say to them, like, any traction is better than no traction. So even if you're just doing straight traction and that's working for you, great, carry on. You don't need the comfort bend. But if you are doing counter bending, then the comfort bend is a real must-have, I would say. It makes such a
Yeah.
difference.
Yeah, that's a really good point, because I actually do have quite a few number of men that don't have curvature of their penis. So they're just using the RestoreX for penile lengthening. And so they're not using the counterbend function. So let me ask you this question. How come you're coming up with these attachments for the existing RestoreX device rather than coming up with a whole new device?
Well, that is an interesting question, Amy. I kind of have come up with a whole new device, and I have spoken to Pathright Medical about it, and they've had a look at it. But the problem with the medical industry is it's so fraught with red tape and bureaucracy, etc., that you can't just bring out a new medical device. It needs clinical trials. It needs so much investment cost wise, and a long time. You can lose hundreds of thousands of dollars and a few years just to bring out another RestoreX type device. So I think it's really a case of the add-ons that I've come up with have made the original RestoreX work really quite well. And although if you could have designed the RestoreX from scratch again, knowing what you know now, then obviously you would make changes to make it different. But we are with it where we are with it because of the costs and the time and everything. So I think yeah, we've got what we've got, and that's what we've got to play with.
Yeah. It's a very interesting conversation because I think I interact with a lot of people that are just like, oh, create a device. And it's just like people don't understand how much time, money, effort, and resources it takes to come out with a new product. And if you want actual urologists and healthcare providers to implement new technology, we're going to be looking for the evidence and the research behind its use, which costs a lot of money to do those clinical trials. And when I talk about traction therapy to my patients, I recommend the RestoreX device because it has so many clinical trials to support its use, whereas a lot of the other products on the market don't. But at the end of the day, if a product is, let's say, uncomfortable for someone, and I have a lot of patients that do just fine, with the existing clamp, but I also have a lot of patients that they love the device, but it's just for whatever reason is a little bit too uncomfortable, and so they're not using it. So I love that you're coming up with these attachments that work with an existing device that has evidence to support its use to make it comfortable for guys who otherwise would not be able to tolerate it. So I think that in and of itself is very innovative to work on something that already is in existence.
Thank you very much.
So is there any other feedback that you've heard from people who have used the Comfort Bend or the 3 mm attachment here?
Uh, yes, I've received a lot of feedback already, and people love it. They're saying, "Wow, this is great!" Thanks ever so much. And um, some people in Virginia, they're concerned that they're going to have to go for an operation, but they don't want to. And now with the Comfort Bend, they're able to do even more stretching, and they're hoping that that's going to allow them not to have surgery in the end, which, I've got my fingers crossed for them because, who wants to have surgery on their penis at the end of the day?
Is there anyone who's not like wouldn't be a good fit for these, devices?
Yeah, I've had a handful maybe of customers that have said it's not for me. I've tried it; it doesn't work. I'm going to stick with the original clamp. And it's like, yeah, great. I'm glad you tried it. And you have to try these things because again, everyone is so different. If everyone had an identical penis, then it would be a really easy problem to solve. But everyone is different in every way. So yeah, it's not going to fit everyone. It's not going to be right for everyone. But if it can help a good percentage of people, then I feel like I've achieved what I set out to do.
Absolutely. So for people watching, if you're interested in trying out this technology, you would need to purchase the RestoreX device from the RestoreX website. And then if you're interested in these added attachments, which include the comfort grip, the 3 mm attachment for a tighter grip, and or the Comfort Bend, then you would go to Richard Connell's website to purchase those attachments. So can you verbalize what your website is and where are these products available? Like where can people live in order to order these products?
Okay, so you go to www.comfortgrip.co.uk, and I'm based in West Yorkshire in the UK. And when you purchase on the shop, it's got the cost of shipping anywhere in the world, and they literally have gone now to, I think, 30 or more countries,
Wow.
uh, from Tasmania, just off Australia, to Peru, to Scandinavia. It's quite staggering where people email me from. It's almost like a small village within the world. It's quite amazing.
I love it. Well, I know people are interested in this topic. I mean, I have people reach out to me from all over the world, who are interested in some of these innovative technologies. But I know your work is not done. I know you're in your like mad science lab trying to figure out what you're gonna, whip up next. So I can't wait to follow your journey to see what is next that you're going to invent to really help like the everyday man, because that's how you're designing these things is you hear feedback from people and then you put your problem solving cap on and you kind of ask yourself, how do I solve this problem? I love that.
Yeah, it is quite an interesting journey, and I'm sure if you spoke to my wife, she would tell you that I'm a genius mind trapped in an idiot's body. I think is one of her favorite sayings. Um, and I try all these products on myself. So while I'm developing all the prototypes, I'm there trying it, and she's there behind me just rolling her eyes.
I love
So,
that. I love that. You're your own experiment. Any other messages for the viewers watching?
um, if you've got Peyronie's, and it is a horrible thing to get, and it really does affect you psychologically as well as physically. Um, Talk to the people around you, and there are these products around that will help, and there's lots of people around like yourself that can help. And so don't feel alone, and really reach out, join a forum. There's lots on Facebook of different Peyronie's groups, and talk to people, and you'll find that you're not alone, and you can get help. And before you know it, you're on the road to recovery.
Yeah, Richard, I think that's a very powerful message. And where traction fits into the discussions that I have with patients is like I discuss every guy who comes in to see me who has Peyronie's disease, in terms of the ability for traction to help them. It can be useful before surgery, after surgery, in combination with injections that we do in the office into the actual scar tissue. And I see a lot of guys who, let's say, don't want to go, in for surgery. And so we really do a pretty aggressive penile rehabilitation program. And that's where traction therapy can be extremely helpful. I also discussed traction therapy in men who had their prostate removed for prostate cancer, in men who have diabetes, in men who have curvature, as we discussed, or in men who have lost size due to whatever reason and are hoping to regain size when it comes to penile lengthening. And that's where, these devices can be helpful. The question becomes, can traction therapy grow a healthy penis? And when I've interviewed Dr. Landon Trost, who developed the RestoreX device, that guy, he does not want anything to do with snake oil. So he will never make a single claim that he cannot corroborate with research, which is one of the things that I think is great about him. And so we don't know if it can help, a healthy penis get longer. I have plenty of patients that see me for penile enhancement, and they're curious to see if traction therapy can help them. And so they use it. And I think some of my patients have benefited from it, but you really have to be compliant with traction therapy. The recommendations that I typically will tell patients is like 30 minutes a day, 5 or more days a week for at least 3 months to see what you get. So if someone's only using it once a week, they're probably not going to get the results that they're looking for, which is why I love the attachments that you're coming up with, because it can help people be more compliant with therapy so they then can see the results that they're looking for. So, Richard, it is always a pleasure to talk with you. I learn so much every time we chat. And I don't know, the next time that we get together, we'll talking about the next innovative therapy you've come up with. I can't wait.
You never know what's around the corner, Amy. I'm sure I'll think of something.
Awesome. Well, thanks for joining us today.
Thank you very much.